According to the WHO, there are more than 1.5 billion people worldwide who will suffer from some degree of hearing loss.
Studies confirmed that 60% of pediatric hearing loss cases can actually be prevented with early detection and immediate appropriate treatment like medications, especially recurrent middle ear infections or long-term undiagnosed fluid accumulations.
It's a very interesting study, Maraheb. So as for older patients, it is shown that more than 1/3 of population more than the age of 65 years will suffer from hearing loss with a varying degree.
So I have a statistics that says 80% of those with hearing loss actually live in low to middle income countries.
Oh.
This study shows actually the importance of screening, awareness, and early detection of disorders. Welcome everyone to a new episode of DocTalk, where we discuss important health topics in a simple language so we can help you understand illnesses and symptoms more clearly. So it's me again, Maraheb Alqalaf, with my amazing colleague, Dr. Sundos Alhadhoud, and we're going to talk today about a very important topic actually that could happen to all of us.
Definitely, and it is ear problems. So people will think that ears are only made for hearing, while there are a lot of function of the ear.
Yes.
Once there is a dysfunction, then the whole thing, your whole body, whole balance
The whole
will be
system.
disturbed.
Yes.
Exactly.
So one of the most important things we have to mention, the ears are not only responsible for hearing, as you said, it's responsible for balance, it's responsible for the gait. So most people actually, sometimes they have vertigo, which is feeling that they want to fall down and pass out and
As
feeling
if you are
dizzy.
in the sea.
Yes.
It's exactly the
Feeling
same.
dizzy. And this is actually has to do with the ears. My mom actually has a problem with the middle ear.
Oh.
Yeah, and she has a problem with her, what we call in public and general terminology, crystals of the ear.
Yes.
Once she wants to get up, she can't get up. She just falls down back. And this is serious, and it's something that you have to take responsibility to fix it by going to the doctor and seeing a specialist.
You know, Maraheb, imbalanced crystals actually now is on the rise, and many people I know are having these problems, and they will tell you, I have crystal imbalance, so you have to wait for me to get up from sleeping position or from lying position.
No.
So this is the problem, that you think the ear, even though it's a very tiny structure, and if you see, if you search the bones of the ear, you will find that they don't even get the size more than half of your first.
This is actually a fun fact. The 3 tiniest bones in your body is actually in the ears, and there are 3 tiny bones. They're called malleus, incus, and stipes.
Yes, it's
So
good you remember the names. I forgot.
I remember anatomy. They're actually the ossicles in general, but they're composed of those 3 tiniest bones.
Definitely, and these bones actually, if they have a problem, they are misplaced or they have calcium deposition on them, that's where we call the crystals actually. It's where the problem happens. There are many problems on them. That's where we call the crystals actually. It's where the problem happens. There are many problems that we're going to discuss today, starting from simple infection to inflammation, to misplacement, to fluid accumulation, and we're going to talk about the causes. But you have to know that some of them are really serious, and not all ear problems, they have signs and symptoms. Most of them, they are silent. We only know from accompanying problems, as you said, imbalance, vertigo, or inability to stay still. When you close your eyes, you feel like you're falling. This is all because of ear problems. Only small percentage that, especially when there is infection, we will have the discharge and we will have the pain and we will have the fever. Otherwise, then it is usually silent.
So let me talk about since I am the princess of anatomy now.
Yes, I can give you the mic.
You're the queen, but I'm the princess. So we're going to talk briefly about the anatomy of the ear. So there are actually three main parts of the ear, which is the external part, which includes the pinna or the auricle, and the external canal, which reaches up to the tympanic membrane. The tympanic membrane is known as the eardrum. And then we can go to the middle ear. The middle ear has the three tiniest bones.
Yes.
And then it leads to the inner ear.
Exactly.
The inner ear has the auditory nerve, and then the semicircular canals, the saccule, and then when we go to the inner ear, we can find the auditory nerve, okay,
Yes.
and the semicircular canals, which are responsible for equilibrium and balance, including the saccule.
Exactly. And you know, there
and
is
the cochlea.
also...
I forgot to mention the cochlea, which is
this is the most important.
Yes, it
yeah.
is.
And you know, don't forget also the Eustachian canal. The Eustachian canal usually connects the inner ear to the mouth.
Right.
That's why when we have sore throat, there is congestion and pain in the ears.
Yes.
It doesn't mean that the ear is infected, but it means that it is related to the ears, because there is one canal connecting the ears to the throat. And if the throat or the sore throat or the bacterial tonsillitis is not treated, then definitely the infection will spread into the ears, and then it will cause ear infection and vice versa. And that's why when we put eardrops, sometimes we can taste them.
Feel it, yes. Also, one of the other responsibilities of this tube is actually balancing the inner pressure with the external pressure. So most of the times when we travel, we actually feel the pressure in the tympanic membrane, right? With the eardrum. When you swallow or pinch your nose and blow, you're going to open up your eustachian tube and you know, have this better balance and better pressure.
That's why we tell them when there is a difference in pressure, you just try to swallow.
Yes.
Or if a baby, let them suck on a pacifier or a lollipop.
Yes,
and
definitely.
Or chew. These will help to circulate the air, and then it will open. So this is the trick, and this is the reason behind it.
And you know what's also important is pilots. Pilots depend on their ears a lot, not only for hearing and listening, for equilibrium and balance. And you know, I'm a big fan of documentaries, and I watch airplane crashes. I don't know why.
Oh my God, no.
So when I watch the documentaries, I noticed that probably, like, I would say a good percentage of the time it's because of human error, which includes because of the pilot's mistake, you know?
Yeah.
But you know what's very interesting about it? They mention that pilots lose their sense of balance. So that's why probably they dive into a deep steep when they like, what do you call it? Ride the airplane. So because of, you know, the fluids in the ear, they keep moving and moving and moving, and they don't have the sense of what's right, what's wrong. They become very dizzy and disoriented of what's going on in the air.
It's really interesting. I would like to watch that, definitely. Once we're on the break, I have to take the documentary. But from what we have discussed so far, I think it gives an idea about the function and benefits of the ear, and what we are going to continue discussing in today's episode. But now I think it's time to take a break, and for the myth and fact segment, you enjoy it as we do.
I love this section.
And
I
see
love
you
this
back
segment,
again.
honestly.
You take care. So now we come to everyone's favorite, which is
myths and facts.
So you want to start, Maraheb?
Sure. I have a myth that says, does ear pain always mean infection?
No, there are many reasons behind ear pain. So not only infection.
Yeah, definitely not. So TMJ actually is one of the reasons that could be, or that could cause ear pain actually.
Nice. So my myth says that if you lost hearing in one ear and the other ear is normal, then you don't need any treatment.
No, you need a treatment, definitely, and immediate treatment.
Definitely. Why? Because this ear will compensate for a period of time. Then it will be overstimulated, overexhausted. With time, it will start to be also impaired. So you need to treat both ears.
Yes. So I have a myth And I think most people are still doing this action actually. So they think that cotton swabs protect the ears from bacteria and clean the ears. What do you think?
No, 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 and a big no.
It's a big no. So you never know what the cotton swabs cause. It just pushes the cerumen or the wax into the ear more deeper, and it probably gonna cause conductive hearing loss due to the blockage on the eardrum.
Definitely, and sometimes it will cause perforation, so you need to be careful, especially if you're not using the cotton swabs or the cotton pads on yourself, you're using it for someone else, definitely will cause perforation, so be careful.
Yes.
So my myth says that tinnitus means permanent hearing loss.
No, it's just buzzing in the ear.
Definitely, even though it is irritating, sometimes it is temporary and sometimes it is permanent, and sometimes it is related to some disorders, but it doesn't mean that it is a hearing loss.
Yes, I agree with that. So I have a myth that says ear infections don't need a treatment. They're gonna go away by themselves.
No, 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 a very big no.
No. So you need immediate medications or intervention with the specialist if you notice even the mildest ear infections. So taking an action to take care of your ears is going to be through seeing a specialist for medications.
So my last myth says that if a child talks and laughs, then the hearing is okay and there is no need to worry about it.
Not necessarily. No.
Exactly. Sometimes when there is fluid behind the eardrum, the vowels or the pronunciation of some letters, it will be impaired. So impairment of pronunciation and sometimes delayed talking are signs of hearing impairment. So just not total loss of speech. This is really dangerous and means something else other than the hearing.
Yes.
But having normal speech and normal laughs doesn't mean that the hearing is okay.
And you know what? I have one more myth. And it's going to be the last one.
Good.
So my myth says hearing loss is only related to aging.
No, never.
No. So hearing loss can actually happen across all ages, even with the young teenagers and early adulthood. It happens and it occurs across all ages.
And the causes are many. A simple infection in the brain or the layer that's covering the brain, like encephalitis or meningitis, can lead to hearing loss.
And hearing loud music as well can cause hearing loss. Welcome back, everyone, and we're gonna talk now about the causes of ear diseases, whether it's external, middle, or inner ear problem. And we're going to talk about the signs and symptoms. So what do you have today? Okay, you know what? I'll start first.
Okay.
So I'll talk about the external
causes of problems,
or problems for the ears. So the first one is very well known. It's called otitis externa, which is known as swimmer's ear.
Yeah.
So swimmer's ears are actually like having an infection or inflammation or fungal infection because of excess moisture in the external part of the ear.
And people think that, and they will come to the pediatrician or the ENT specialist, and they will say that every time my child swims, there is an inflammation or infection. What can I do? And I tell them, don't worry, this is very common. This is called swimmer ears. And it's only infection and inflammation on the outside, so it did not go inside, so don't worry about it. You just do some precautions. You can cover the ear while the child is swimming and put a Vaseline with cotton. All of these will help to prevent swimmer ears infection. Now we come to the middle part, which is very common, very common.
Yes.
And usually this involves the inflammation of the canal and the eardrum. So this we can see. Usually this is before we're going to talk about the causes. Usually this is bacterial, viral, or even fungal. I've seen the worst degree of fungal and bacterial infection of the otitis media. Greenish smelly, watery discharge. The mother will say, whenever my child is sleeping, I will wake up the child or remove the child from the pillow. I can see greenish discharge, and it's really smelly. So this is the extreme form or extreme degree of the infection.
And most kids actually have and develop otitis media.
Exactly.
Which affects the speech development as well.
This is what I'm going to talk about, and why does it affect? First of all, bacterial differs from viral. Viral, usually there is a fever that usually does not exceed 2 days, and sometimes it is high grade, which is more than 38.5, but most of the time it is low grade. So, and usually it's 1.5 days, not more than 2 days. But if it exceeds 2 days, and if the temperature is really high, and you give an antipyretic, which a drug that reduces the temperature of the baby, and you give it every 2 hours, you need it every 2 hours or every 3 hours, and you alternate, then the baby needs to be checked. And you have to put in mind that one of the causes might be a bacterial otitis media, which is infection in the inner ear or the middle ear. How do we know? We usually examine the eardrum by the otoscope. Usually the color of the eardrum, it is shiny. And usually it is light pink to whitish, and the eardrum usually is transparent. So when it is cloudy, when it is very bright, shiny, and it is congested red, and sometimes it is black, then definitely this is infection until proven otherwise. So this is where the time we need antibiotic. And I always tell the parents, you have to treat in order for you to avoid chronic otitis media or the secretory otitis media, which is recurrent infection to the middle ear and not treated. And if left untreated, then there will be accumulation of fluid behind the eardrum, and this one you cannot see it by the regular otoscope.
It has to be surgery to be done using PE tubes.
Exactly, and this is where you need further investigation. And you know, it is really interesting. I had many patients referred to me where the parents suspected that the child is autistic, because she said, I called the child and the child is not responding to me. I call the name, and this is one of the signs of autism, so please check my child. And I tell them, before I do all the investigation, please go check the tympanic membrane where we do tympanoscope or tympanometry and come back to me. 90% of the cases, it is positive. And I tell them,
and it cannot be seen actually. It's not like a textbook symptoms. It goes hidden and undiagnosed, right?
And they will tell me, you're a doctor, you check it with your otoscope. And I tell them, it will not show. We need that test to know if there is accumulation of fluid behind the eardrum. Now, one of the problems and actually the misfalls of using the cotton pads.
The cotton swabs, you push. Actually, this is what I wanted to mention actually.
The wax,
the cerumen impaction. When you use a lot of cotton swabs or cutting, whatever you call them,
cotton pads or buds.
So you push the wax inside against the tympanic membrane or against the eardrum.
But this is not the thing I'm worried about. Sometimes you are very aggressive, especially if you're not doing for yourself. You're doing it for your child or someone else.
And then you perforate the tympanic
membrane. And this will show on the otoscope. So I had many cases also. And when I look, I will tell them, did you attempt to clean your child's eardrum or ears? She will say, yeah, why? And I tell them, I can see an opening. And they will say, what's going to happen? My child now is going to be deaf. I tell them, no, don't worry. It will take a few weeks and it will heal by itself. So you just give them some time. And the only instruction I give you, while you are diving in water, you put Vaseline and cotton plugs so the water will not go inside.
It's very interesting because I remember when I studied in the US, we had a case of actually a child was playing with a pencil, and then I can't even remember the gender. They put the pencil inside the ear and it perforated the eardrum. Which is a very interesting case, honestly.
It is, and you will be surprised how many children, and not the young, actually the older ones, I see foreign body insertion in the ears.
Oh my God, bugs.
Between 5 and 15 years of age.
Oh, wow.
They are very curious. I don't know why this age group. And they try to insert everything inside. As you said, pen, keys, toys, bugs, ants.
Oh, wow.
Yeah, so
you've seen it all then.
I've seen it all. Believe me, when you are a pediatrician,
oh, wow.
you are never surprised. You see everything. Now, Maraheb, I think we covered the parts of the ear, but I think there are certain points also we need to discuss.
Right.
But after a very interesting report, which is healing and a plate. So just watch the report, enjoy it, and we'll see you back again.
Welcome back, dear viewers, to the last segment of the episode. And I want to continue actually to what Dr. Sundos said before the report. There are actually vital points that we have to mention. I want to mention conductive hearing loss and sensory neural hearing loss. What is the difference between them? So conductive hearing loss, anything that happens in the external part and middle part of the ear, like having extra wax against the eardrum, or having, you know, the extra fluids in the middle ear. This causes conductive hearing loss, which most of the time can be temporary.
And it means that the voices or the waveforms, they are not conducted inside.
Exactly.
So that's why it's called conductive hearing loss.
Exactly. And there is actually, you just reminded me, there is actually a test where they use the mastoid bone. They put a vibrator on the bone.
It's really interesting.
Yeah, so it can shake and send the vibration directly to the inner ear, so you can hear it, and you can perfectly hear the sounds, which is very interesting. And we have the sensory neural hearing loss, which involves any damage to the auditory nerve, the cranial nerve responsible for hearing, which can be having a tumor on the nerve itself. So anything that happens to the inner ear and affecting especially the auditory nerve, like having a tumor on the auditory nerve, which is called acoustic neuroma, or maybe a genetic factor. There's someone in the family with hearing loss affecting the auditory nerve, then we're going to expect a sensory neural hearing loss, where the patient is recommended to wear either a hearing aid or go through a cochlear implant.
Exactly. And now I think, Maraheb, there are also other causes for hearing problem or ear problem. One of them is autoimmune diseases.
Right.
As we said, if the autoimmune disease affect the nerve, affect the bone, affect the connective tissue, then definitely hearing will be impaired. Some of the genetic disorders, like Meniere disorder, where they have vertigo, where they have neuroconductive disorders, also the same thing. Other causes like infection, tumors, and infection, we mean infection in the brain, like meningitis, encephalitis.
Right.
It's definitely will affect the nerve in the neurotransmitter disorder, hearing loss. And there is also, other than infection, tumors, as we said, there is injury to the ear itself.
Right.
So there are many causes. And don't forget the aging hearing loss. Most people, while they reach the age of 65 and older, they will start to have decline in their hearing assessment and hearing ability. So some of them will require, as you said, hearing aids, but most of them will just, you have to raise your voice in order for them to hear it, or they will ask to raise exactly the voice of the television. So many tests can be done. We said either through the otoscope, through the tympanometry, through nerve conduction, through CT, MRI, all of these
brain
can
stem
be
response as well.
Exactly.
ABR.
Exactly.
So being exposed to prolonged loud music or loud voices actually causes hearing loss at younger ages. And we can notice the difference between regular aging drop with hearing and when you're exposed to loud voices or loud, environment. We can see like a cookie shaped in the report, actually.
Yeah. And Maraheb, this is what our grandmothers and mothers say, that don't use the headphones for too long, don't listen to loud music, it will affect your hearing. And it is actually proven statistically and through studies that it affects the hearing ability on the long run. So just be careful and take care of your ear and hearing sensitivity.
And not to mention, Dr. Sundos, there are certain of professions actually, they're exposed to loud voices.
Unfortunately,
like,
yes.
Construction workers, because they use lots of drilling, and workers in the airplane section, let's say sector, who guide the airplanes, they're exposed to loud, airplane engines and, coming and going. So that's why you see them actually wearing earmuffs.
Yes.
So they can protect themselves from the loud noises.
Exactly. So following safety precautions is very important. Don't think that I am immune to any, let's say, complication of the job. No, you have to follow the safety precautions. It was put there for a reason, to protect you on the long run, not the short term. So just follow the safety precautions of your job. Now we're going to talk about the most thing that most parents worry about, which are the tubes, the draining tubes. So for fluid accumulation behind the eardrum, for untreated or recurrent otitis media, we said, how do they treat it? People will think that they will do surgery, they will put an opening and then the water will drain. It's not like that, because as we said, it will heal within 1 week, 7 days, 5 to 7 days. So what they usually do is actually they put an opening, but with a tube that is there, and it will stay from 4 to 6 months. Some cases it will stay even longer, for up to 2 years, and they might need to re-put it. But once the fluid has already drained, it will fall by itself. So they do it as a day case, no need for general anesthesia. They do only analgesia. It's not painful at all, but because of the discomfort of the child, they give analgesia, so the child will not be scared. They just put the tube and it will go by itself. Sometimes when it's, the doctor will follow up and will check if another tube will be inserted or not. So one tube is not enough, and usually it is bilateral, so they put it on both sides. It's not one side only.
So very interesting to know that. And also, as a speech therapist, I do notice once the child has the surgery done, the next day the hearing is so much better. And parents notice that the child actually acquires lots of vocabulary once the surgery is done, which is amazing, honestly.
Maraheb, I have an ENT specialist. She's a good friend of mine, and I asked her, what is the most question parents ask you about? And she said, you will be surprised. It's not when the tube will fall or is it painful or not. Why do you have different colors? So my child, you put for him or her green color tube, while I know the other child you put purple, and that a friend of mine, they put orange for her. So why do you have different colors? And she tells them it depends on the company. It has nothing
It's like
to
the
do.
braces when you put the different colors, right?
So just put that in mind. Different colors doesn't mean that this child is better than the other one. It depends on the company, the size that is needed for that child, and the age and weight for that child. So I think we covered most of the tips and points that you need to know about ear problems. Remember to take care of your ear, even though it's a very tiny structure, but it is very important, not only for hearing, for balance, and for your overall well-being. I hope you enjoyed our today's episode, and see you again in a new episode in our program, DocTalk. You take care.
See you next time.